Welcome back to the program. Now, 2020 is a year that will be hard to ignore when the history books are written, as the coronavirus pandemic continues to redefine life as we know it. Trade pacts have been put on hold, referendums have been postponed, and major sporting events have been cancelled. But more worryingly is the number of lives that have been lost and livelihoods shattered by COVID-19. Tonight on the program, we explore the impact of COVID-19 and what the future holds through the eyes of two high-ranking diplomats. The UK High Commissioner to Kenya, Ambassador Jane Marriott, joins us on the program, together with the US Ambassador to Kenya, Ambassador Kyle Makata, as well. To both of you, Excellencies, thank you so much for your time and for joining us on Newsnight. And Ambassador Marriott, let me start with you and help us understand how your government has been involved in providing assistance to Kenya, whether it's in terms of public health advice, whether it's in terms of economic assistance, in the wake of the disruption brought about by COVID-19.
Thank you. So the thing about a pandemic is we're all in this together. It's a global pandemic. And you can have one country that handles it brilliantly, and then other countries, if they don't handle it as well, then no country benefits. So we're in this together, and it's all about working through. So the UK and Kenya, I think, as ever, are working in partnership and learning a lot from each other. Crucially, Kenya, when it locked its airspace down in March and put in social distancing measures, the UK was doing the same thing. And I think social distancing measures and education have been really key to reducing the numbers of deaths from COVID. Directly, so we are working really hard on a vaccine. We're one of the biggest international donors to trying to find a vaccine. And with our 30-year partnership between the University of Oxford and KEMRI here, of course, we've been able to take great steps forward in developing a vaccine. The Oxford trials in the UK are now have done stages 1 and 2, and we've just announced another 150 million shillings to back Kenyan scientists into research and innovation here. It's really important we get a vaccine. It's really important it's accessible to all.
Okay, and the vaccine conversation will be coming up a bit later on, Ambassador Marriott. We'll get a bit deeper into that because I know a lot of Kenyans want to know more. But Ambassador Makata, you can come in as well. Also just talk to us a little bit about any partnerships you may have with Kenya in terms of assisting with the disruption in terms of COVID-19. And feel free to mention a little bit about the vaccine discussion. We know there's a race out there around the world to get a vaccine.
Well, I think what's important to remember is that the United States has been hit harder than anyone in the world. But in the midst of that, the United States has continued to be the most generous. Over $1.5 billion has still been spent to help others in the world with COVID. And a very large part of that has been with Kenya. And over 5 billion Kenyan shillings has been spent to invest in clean water, to invest in testing and train healthcare workers to how to deal with COVID. But I think the part that we sometimes forget is that there's been an investment by both of our countries over the last 5 decades. And the 800 billion Kenyan shillings that the United States put into PEPFAR to address the HIV/AIDS situation in Kenya was an investment that is paying off for the health of Kenyans today. And so those investments to deal with malaria, to deal with TB, and all these things. In fact, you look at the testing today. In fact, we've just seen CS Kagwe visiting one of these institutions in Kericho, where over 55% of all the tests run in Kenya on COVID today is on equipment that the United States invested in many, many years ago. In fact, this is the highest, the best technology available in the world. And yes, are we fighting for regents that keep that going? Yes, we're all fighting for that because that's the whole world wants them. But the investment that was made even 50 years ago, we're reaping dividends from that today. And so those people that were trained, this is not just machinery. These are Kenyans that are trained to use this machinery to do good, not just for these previous, for malaria, TB, and HIV/AIDS, but now COVID. And I think when it comes to vaccines, I think you're going to see the investment in the Kenyan researchers themselves. These people are going to be proved to be the answer for possibly the next vaccine. If not this one, for the next pandemic.
Okay. And as I mentioned earlier, we'll be getting into the vaccine discussion very soon, because I know many Kenyans want to know how long it might take from the announcement of a commercial vaccine to its arrival on, in the Kenyan shores. But Ambassador Makata, just staying with you, we've seen you quite active on your social media platform talking about tourism, and we did see you actually out there promoting a bit of Kenyan tourism on your social media account, which is why some Kenyans then wonder why there is a high-level sort of risk travel alert against Kenya at a time like this. It doesn't make sense to them. Please help us understand, Ambassador.
Well, I think it does make sense. And I think, Kenya is with 95% of the rest of the world in regards to this travel notice. I mean, this went from a do not travel to a reconsider. It's actually getting better. As we deal with COVID, as we learn how to manage it, as it becomes safer, we can tell people, go, travel. And we have. And so that was a worldwide notice that had within it the same precautions that were in it a year ago. So this probably shouldn't have been as big a news as it was. I think the story you should look at is who believes it's safe to travel in Kenya? The ambassador from the United States does. I mean, with or without security, I would be going to Hell's Gates. I would be going to Naivasha Lake. I would be going to the Mar. All these places that I have gone to, not just so I can personally, me and my wife can get out after being, for 5 months now dealing with COVID. Get out, see magical Kenya, see safe Kenya. I think what I've done is probably a greater indication as to what can be done in Kenya and how you can travel safe. And so I don't think there's a contradiction whatsoever for me to say to USA, Marafiki, everyone in the United States, come to Kenya, travel safe.
Okay, and I want to bring in Ambassador Marriott shortly on this, but would you then say it's safe to travel to the States, Ambassador Makata?
Yes, absolutely. Listen, this comes down to where you're at, who you're with, and how you behave. And it comes down to personal responsibility. I mean, everyone, the first question I get on most interviews is, how has the Kenyan government done? And I say, I think they've done well. I think, but it really comes down to not what the government is going to do as much as what individuals are going to do. And whether individuals are going to follow these guidelines of being safe, and that is washing their hands, covering their face, social distancing, staying home if you're sick. I mean, the biggest part of the success we will have a COVID will be based on those very simple principles. And I think it's important for me to put that out and show that.
Okay, let me bring in Ambassador Marriott now. Ambassador Marriott, feel free to respond to anything that Ambassador Makata has said, but let me add this to you as well. The UK has a list, a travel corridor list, a travel corridor exemption list, and unfortunately Kenya and many African countries are not on that list. Please help us understand the thinking behind what makes certain countries sort of able to have their nationalities get into the UK without quarantine, and others would have to get into 14 days of quarantine. Ambassador Marriott.
Absolutely, and I'll come to that in a second. But Kyle's point earlier about it's the wider investment, the longer term preparation that I think has seen helped see Kenya such a good response is really important. So the UK in 2016 helped set up Kenya's Public Health Emergency Operations Centre, which has been at the heart of Kenya's COVID response. And we've been working with the Ministry of Industry on protocols, sort of the Business Operations Centre, protocols to get businesses to keep operating in Kenya, and crucially those jobs flowing, those Kenyan jobs flowing, and keeping food on people's tables. So that longer term healthcare investment is really important. And if one thing comes out of this global pandemic is that we all need to pay attention to the importance of our healthcare systems. And obviously President Kenyatta's universal healthcare ambition plays into this very nicely as an important part of it. On your specific question on travel, so Kyle and I have been trading holiday snaps. So I've managed to go to the Mara a couple of times and up in Laikipia, and I've been really impressed with the way in which the camps are implementing the COVID protocols to make it safe for tourists to come here. And I really hope that we will see British tourists back here before too long. At the moment, the travel corridor and the quarantine is the country that you're coming from. So it's not about Kenyans. It's for people who are coming from Kenya or from other countries where the COVID situation is still increasing rather than decreasing. But I very much hope to see Kenya on that exemption list and more easy travel between our two countries before too long. Flights have only been going for 10, 11 days, and that's a great start in the right direction, and I hope to see more of it.
So the situation might change depending on, in a sense, what our statistics are in the days to come, Ambassador Marriott?
Exactly, and it's something we're keeping under constant review. Personally, I'm very keen to get British tourists here to experience the wonders of Kenya and get the Kenyan tourism industry moving, getting some of those jobs back to communities who've really suffered due to the absence of tourism. But as CS Bilala and I were discussing the other day, the important thing is about growing tourism back in Kenya in a green, sustainable way. This can create more jobs, not less, but it's about making sure that communities in Kenya are protected, and as climate change becomes more of a part of our daily lives, and we see the floods and the fires, that the local communities are bought into tourism and are benefiting from tourism.
Okay, I'm sure what both of you have said is something that tourism stakeholders will be following quite closely. Now, both of you got me into the vaccine discussion at the very start of the program, but, we can get a bit deeper into that right now. And of course, we are seeing, in a sense, a race. And Ambassador Makata, I want to start with you on this one. A race to get a vaccine, whether it's in the UK with what they're doing at Oxford and with other initiatives, and with America as well, with the strides we are seeing with Moderna and others that, you are probably more aware of than I am. But there is a concern from some that certain nations are pre-booking doses in advance, and we haven't heard such news about Kenya. Talk to us about the search for a vaccine, Ambassador Makata, and what you think it would take to get that vaccine onto Kenyan shores.
Well, first of all, I think you've seen President Trump engage the private sector and say, listen, we want this done. We want you working on this 24/7. That's what they've been doing. We need some predictability in the midst of this pandemic. But I think we have to, as much money and time and effort as we put into the researching this, developing this, actually delivering this, again, we have to be careful as to how it is launched. I mean, this has to be tested. This has to be, we have to make sure that a vaccine is safe for people. So I think some people may be getting a little bit ahead of themselves by claiming they're going to take it first. I don't think that's really the discussion that should be had right now. I think the discussion should be how we can come up with a safe vaccine, because it needs to be safe for everyone, for every country. And I think these talks of which country means less might be the ones we experiment with is just total nonsense. No country should be the one that has to be the guinea pig. I think we have to make sure this is safe. We have to make sure it's dependable, predictable, and but the United States is going to spend as much time and effort and resources as we have to get there.
Okay. And Ambassador Marriott, just picking up from what Ambassador Makata has spoken of, you did obviously note the hullabaloo that was raised in this country when a journalist in the UK spoke about Oxford trials that could take place in Kenya as well. And many Kenyans were concerned about the possibility of some of the citizens here being guinea pigs. But at the same time, virologists making us aware as a nation that if we don't take part in trials, we could miss an opportunity to get a first chance at the vaccine when it does get out. Your thoughts on how far those trials are and also the opportunities for Kenya?
Well, first of all, Kyle's absolutely right. We all want to be first with a vaccine, but it's got to be safe, and it's got to be something that we've worked through the potential second, third order effects of this vaccine. It's really difficult to develop a vaccine. It's very expensive. It requires a lot of expertise, and the crucial thing, as far as the UK is concerned, is that this is a vaccine that is available to all globally, and that the pricing is such that it's accessible to all countries. And I know that Kenya is one of those on the list through the Global Vaccine Alliance, Gavi, who would get the vaccine when it is available. Obviously, there's going to be a supply and demand, and there's not going to be enough doses globally immediately, but that will come with time. Now, look, the UK has been working with the University of Oxford and KEMRI here for over 30 years. It's a really established scientific partnership. Together, they helped do the Ebola vaccine trials. I mean, goodness me, 10 years ago, who would have thought we would have a vaccine for Ebola? We've got one now, with thanks to Kenyan cutting-edge science and scientists here. Ditto on a pneumonia vaccine, malaria bed nets. There's great collaboration going on between our two countries. But the key is it has to be safe. So the first trials were carried out in the UK, sort of phase 1 and 2 at the University of Oxford AstraZeneca vaccine. But now it does need to be trialled in different places as well, having met those safety thresholds. And that's really important to clear. This is not just sort of random experimentation. This is scientific vaccination programs. And it will only happen if the government of Kenya is in the market for that. And I hope that they are. And I will be, one of the first in the queue for that vaccine if people are worried about whether it is safe or not.
Oh, that's a very strong statement to make. I know I'm due for my first break, but both of you seem keen not to wade into when that vaccine might be commercially available, whichever country gets it right first. Any predictions, Ambassador McCarter?
No, I think briefly. I don't think this is anything that we have the ability to predict. I really don't. We hope for the best. Mm-hmm. We'll leave that to the professionals. We'll leave that to the researchers to do the best job they can, and then we'll support them once they come out. Okay, Ambassador Marriott, do you choose to go with the same response, or might you have some new update for Kenyans?
I'm not normally a gambling woman, but sometime in 2021, I think we will see a commercial vaccine entering onto and whether it's the game changer that we need for the sort of the post-COVID world or not remains to be seen, because it depends how long the antibodies and the vaccine is effective for. But what is clear is that we are in a world where COVID is always going to be with us in the way that the flu is with us. So it's all about mitigations, making sure that our health systems are up for it, and then with the good help from the vaccine when it comes out, and I'm going to say sometime in 2021.
Okay, I'm not a gambler either, but I think I like your gamble. I know many Kenyans would like to hear of a vaccine even sooner than 2021, but the scientists are the ones doing the work. We're going to have to leave it to them for that. Well, we're due for our first break. You're watching Newsnight. I've got so much more to discuss with these two high-ranking diplomats. I believe this is the first time this is happening on TV. When we come back, we're going to talk about the war on corruption. We're going to talk about trade deals that were being worked on before COVID hit, what COVID means for them as well, and of course, how they see the